Hello and welcome to another live broadcast with MedStar Health. My name is Mishan Bowman, and today I'm joined by Dr. Eric Wazatsky, Chief of Rehabilitation Medicine at MedStar National Rehabilitation Hospital. Today we're going to be talking about recovering from COVID-19 and how to manage the long-term effects of the virus. For many of us, recovering from COVID-19 is a long, tedious journey. And if you or a loved one has had COVID-19, we're here to show you how recovery is and what that process looks like and share tips to help you feel like yourself again. So if you'd like to learn more about the recovery process and therapy options that we provide at MedStar Health, stick around, share this broadcast with your friends, and ask us your questions in the comments. We're going to take some time to answer those as well. So Dr. Wazatsky, thank you very much and thank you for joining us today. Welcome. Before we begin our discussion, could you tell our viewers a little bit about yourself?
Sure. Thank you, Mishan. It's really just such a pleasure to be here and to talk to you all. My name is Eric Wasatsky. I've been with MedStar Health for almost 10 years now. It's been flying by. And I'm a physical medicine and rehabilitation physician, also known as a physiatrist. And we're doctors that help people rehabilitate and recover from a variety of illnesses that affect people's function. And my clinical day job for the last 10 years has been directing our cancer rehabilitation program. So I help people with cancer and a history of cancer to recover and improve their function. And we felt that that was a good transition for me working with the COVID population on their recovery process. And so far, this has been a really interesting and rewarding experience working with people with COVID. And I'm just so happy to be a part of this program.
Great, thank you. We appreciate you taking the time out to speak with us today.
Thank you.
Thank you. So let's get started with our questions. So for those who have recovered from COVID-19, oftentimes they're referred to as long haulers or having long COVID or post-COVID syndrome. So could you explain the differences, if there are any differences between those and what post-COVID syndrome is and what you've learned about the lasting effects of COVID?
Yeah, I'm really glad you brought up the naming issue because I think this causes some confusion. The bottom line is all the names are really referring to the same thing,
Okay.
prolonged symptoms after COVID illness. However, Dr. Fauci and his team did just put out some terminology that they're recommending to be kind of the standard term for this that you may see out there in the literature more often now, which is PASC, P-A-S-C. It stands for
Okay.
post-acute sequelae of COVID. Sequelae is a word that means the after effects of. And they're defining this as symptoms lasting for more than 28 days after COVID illness. So that's really going to be probably the primary terminology at this point. And to your question, what are we learning? Wow, we are learning a lot every day and seeing new things every day. As we're all as a medical community and a society, learning about the after effects of COVID. But there's just so much we don't know, and that's actually why the National Institutes of Health just put out a call for research proposals to really accelerate the research and our learnings about what patients are dealing with, so we can learn more about how long this lasts, why this is happening, what are the best treatments for patients. So we certainly hope within the next months to years, we're going to be knowing so much more about this than we do now. Things that we do know are that, symptoms are affecting, multiple parts of the body, heart, lungs, gastrointestinal system,
Mhm.
muscles, brain, and joints. And, interestingly enough, it's not just people who, were really, really sick with COVID. It's not just people who are hospitalized on a ventilator, needed oxygen, et cetera, that are having these persistent symptoms. It's even people that had, what you might call more of a mild initial illness with COVID that are still even having persistent symptoms after that illness.
Okay. Thank you for going through all of those details. It seems like that virus has just, it can affect all parts of your body. So thank you for going through that. So millions of people have contracted COVID-19. What percentage of patients are experiencing the long-term effects, and are there any certain groups who have a higher risk of suffering from them?
Right. So, one of the themes of the day today with a lot of these questions is, there's so much we're still learning. And even with the research that's coming out, sometimes we're finding conflicting findings about a lot of these things. The frequency of persistent COVID symptoms is one of those. So, some studies may say it's more frequent than others. For example, a very recent study from the University of Washington in their patient population showed about a third of their COVID patients having persistent symptoms anywhere from 3 to 9 months after COVID illness. While another recent study showed it was less frequent, maybe only 1 out of every 20 people, about 8 weeks after illness, and only 1 out of 50, more than 12 weeks out. So, as you can see, those numbers certainly can vary. But in terms of the risk factors, many of those have been pretty consistent in terms of risk factors for COVID, but also for persistent COVID symptoms. That would include, older patients being overweight, so certainly want to be in the best shape you can be. It seems that women are reporting these symptoms more frequently than men. And there's also some other medical issues that people may have that seem to correlate with some of the persistent symptoms like high blood pressure, asthma, diabetes. And one interesting point that's been found is that it seems that people who have a wider range of symptoms at the initial onset of COVID have a higher likelihood of going on to having persistent symptoms. So, for example, if you maybe just have fever and a cough when you have COVID, you might be less likely to have long-lasting symptoms than someone who has fever, cough, headache, weakness, dizziness, et cetera, et cetera, et cetera. So maybe the more symptoms you have early on, the higher likelihood that those symptoms may linger around for a while.
Okay.
And we've been seeing a good number of patients here with persistent COVID symptoms, and we are keeping track of the types of patients we're seeing. Our data matches what has been seen nationally and internationally. We are seeing a preponderance of women. Our actually peak age group is about age 30 to 50, and we're seeing medical conditions associated with persistent COVID symptoms, including allergies, asthma, and diabetes, are what we've seen most frequently in our patient population.
All right. Thank you. Thank you very much. At this time, I want to take a moment to welcome our viewers again. Thank you very much for tuning in. Today, we're discussing what it's like to recover from COVID-19 and how to manage the long-term effects of the virus. I'm joined today by Dr. Eric Wazotsky, Chief of Rehabilitation Medicine at MedStar National Rehabilitation Hospital. We have more to talk about, so stick around. Share this with your friends, give us a like on Facebook, and share your questions with us. We'll take some time to answer those as well. So back to some of our other questions. Once a patient recovers from COVID-19, what are the most common long-lasting symptoms and conditions they could have? I think you touched on this earlier, but could you reiterate that a little bit?
Oh yeah, absolutely. We'll talk about this a lot today. I mean, the list is unfortunately too long of the symptoms people are suffering with after COVID. Far and away, and this has been reproduced in basically every study, the most common persistent symptom is fatigue. We certainly see that a lot. Shortness of breath, loss of taste and smell. I'm sure most of people have heard about on the news.
Mhm.
Difficulty sleeping. And this phenomenon that many people like to call brain fog. Some people in the medical community don't like that term, but it's basically difficulty thinking clearly. And there was actually one study that showed that up to 88% of people with persistent COVID symptoms may suffer from some of these brain fog symptoms. It could present with some memory loss. Word finding difficulty is actually one of the most common things that we've been seeing in our patients. We work very closely here with our neuropsychologists that we'll be talking about today, who test people's thinking, and they're finding these word finding difficulties very, very common. This is many people will call it the tip of the tongue phenomenon. It's, oh, that word is at the tip of my tongue. I just can't think of it. So many of our patients are reporting this. And, as far as the people we're seeing here, it's similar to the national data. Most common symptoms: fatigue, headache, shortness of breath, sleep difficulty, brain fog, mood symptoms as well. Many of our patients reporting feeling, somewhat down and depressed, anxious as well, which is certainly understanding as you're recovering from this very difficult illness.
Mhm. Now, are there any techniques or things that people can do at home if they're experiencing any of these symptoms?
Absolutely, absolutely. We'll talk in a moment about what the medical community can offer, if you will. Um, and I would typically will recommend people seek medical care if they are having persistent symptoms. Um, but there are certainly things you can do at home that can help. Certainly, number one, reach out for help. No one should be going through this alone. So, reach out to your loved ones and see what kind of support you can get, both physically and emotionally, as you're recovering from this. Some people do find it helpful to kind of log their symptoms at home, so they have a better sense and idea of what their symptoms are, when they feel them. Sometimes that can help figure out if there's any triggers, like, oh yeah, I got those headaches after I was, on my iPad too long, or something like that can be helpful. And one of the things people can really do at home is what we call energy conservation. And oftentimes, our patients will go through some training in energy conservation, typically with our occupational therapists. And energy conservation is exactly what it sounds like. It's learning how to use your energy stores appropriately throughout the day. So it's strategizing your day. What part of the day do I have the most energy? Okay, at that time of day, that's when I'm going to do my most difficult tasks I have to do.
Right.
Can I spread activities throughout the day? What is my home setup like? Do I have things spread all over my house so I have to constantly go from room to room to do things, or do I have things consolidated so I don't have to move around so much? So there's a lot of different techniques you can use at home that can help you conserve your energy. Certainly physical activity is important. And, this is a tricky one because some people that are recovering from COVID will say that their symptoms are triggered by more physical activity. However, we still do typically recommend it, but it's a question of kind of slowly building up that physical activity and listening to your body. And for some patients, they really do benefit from building that physical activity under the supervision of someone like a physical therapist, which we do refer many of our patients to. Make sure you take breaks throughout the day. For the sleep issues and fatigue, sleep hygiene is critical. So, making sure you're setting up your sleeping area for success, where it's a quiet area free from distractions, limiting electronic input before bed. Certainly with some of the cognitive issues, many people need to write a lot of reminders for themselves at home. And as we talked today about, one of the more perplexing persistent symptoms of COVID-19, these taste and smell issues, there are some things that you can do at home. Many of our patients will work with our speech language pathologists for these symptoms, but at home you can do something called smell training, which is basically smelling a lot of different types of things to help kind of reawaken your sense of smell. Many people will use essential oils or different, strong smelling products to help restore that sense of smell. But that can also be done under the supervision of a medical professional as well.
That's very interesting. And leading up to this event, we did receive a few comments and questions about how to restore that sense of smell and people who've lost their sense of smell or taste in some instances. So thank you for going through that. So what options are available for patients who need additional help from a medical professional?
Yes, I mean, there are a lot of options. And, the tricky part of this is, there is not yet a magic infusion or medication or one simple quick fix that resolves these symptoms. I wish there was, and I hope there will be. So, it really does take a village because when patients have a number of different symptoms that are affecting different parts of the body, they really do need multidisciplinary care. And that's really what we've been focusing on in our COVID recovery program here. Our patients get kind of an initial consultation with myself, Dr. Roten, one of my colleagues, or our fantastic physician assistant. And then we work with, specialists from all through our system in different specialties to help address, a variety of your symptoms. So, if you have cognitive symptoms like we talked about, that brain fog, most of our patients have been seeing our neuropsychologists who do very detailed testing to figure out exactly where your thinking is going wrong and looking at some of the underlying factors. And you may go see one of our speech therapists for cognitive rehabilitation to help improve those symptoms. If it's headache, there may be some medications we recommend. You may need to see one of our neurologists for further evaluation. For the fatigue part of things, many of our patients are going to physical therapy to build up their strength, build up their physical activity, or work with our occupational therapists as well. But if it's really more the shortness of breath piece, they may need to see one of our pulmonologists to work up any pre-existing lung issues. For the dizziness piece, for many patients, they may have actually an inner ear issue, or we call vestibular issue. Those patients can undergo what we call vestibular rehab. They work with our physical therapists on improving, decreasing the dizziness, improving their balance. You may need to see an ear, nose, and throat physician as well. And for the taste and smell symptoms, always do recommend you see one of our ear, nose, and throat physicians, because there can be other things besides COVID, that can cause those symptoms. There may be some medications that can help. And we talked about some of the smell training as well as taste training can be available under the supervision of our speech therapists. And we really do want to look at the sleep difficulty as a really important issue, because sleep affects everything. So it's certainly something that will be addressed by our neuropsychologists. For many patients, we end up recommending melatonin, but that's something you should discuss with your healthcare provider. Again, discussing sleep hygiene, working on that exercise piece, because we know that physical activity helps with sleep. So from the medical standpoint, as I said, there isn't necessarily a cure, but we try to look at all these symptoms individually and as a team that's working together to care for our patients, so we can hopefully get people moving in the right direction with these many symptoms.
That's awesome. Thank you very much for explaining like the multidisciplinary approach. It takes a village to help people get back to at least feeling more like themselves again, and get back on track with their health. So thank you very much, Dr. Wozacki. At this time, I do want to share some questions and comments that we've received from social media. So this is the perfect time to ask us your questions in the comments below. We did receive a message from someone who is curious about any holistic approaches. I think you touched on this earlier in regards to your question about what people can do at home on their own time, as well as if there's any options through the COVID recovery program for people who are just looking for more of a holistic response to these COVID symptoms that they're having.
Yeah, I think most of what we do in helping people manage these post-COVID symptoms would fall under the umbrella of what you would call a holistic approach. And that really starts with even how we evaluate our patients. Everyone who comes in and sees us in our program, we do a pretty extensive battery of testing before they come to see us to assess things such as, have you had difficulty returning to work? Because we want to talk to you about that and see what we can do to help you get back to work. We look at social determinants of health. So we ask people if, due to their illness, have they been having trouble paying their rent, or, food insecurity and things like that. And our program actually has a community health advocate to help our patients with those issues when they come up. So I think it doesn't get any more holistic than that. I mentioned all of our care is really multidisciplinary. That's quite holistic. And, as I stated, most of the treatments we end up recommending for our patients are not prescription medication treatments, although sometimes they can be. They really are holistic approaches. They're exercise, they're relaxation techniques, they're working on the energy conservation techniques we talked about before, physical, occupational, and speech therapy. So really what we found is for most people, the holistic techniques are what seem to be most effective for many of these symptoms, but certainly other medication and other medical treatments may be appropriate as well.
Great, thank you. We have a question from Roseanne. Thank you very much for your question. She asks, how long can you be winded after recovery? She's asking for a friend. And I believe this could vary from person to person, but generally, what have you seen?
Yeah, again, as I mentioned before, as you said, it can certainly vary. And, the studies are showing people are having these persistent symptoms maybe as long as 9 months or more. And, we're lacking in data. We're only a year into this pandemic, at least here in the United States. So, as time goes by and people have longer lasting symptoms, we're going to probably find out that these symptoms for some people are lasting even longer. And I think one of the things that's really important is that we try to piece together, how much of a person's symptoms are just what we call deconditioning, meaning
Mm.
you've been sick, you've been in bed, you haven't been doing that much, and we need to build up your strength, versus something that's more lung related, as we call pulmonary shortness of breath. And if that's something that requires more testing of your breathing and evaluation for other treatments. So really, it's all about the thorough evaluation to
Okay.
get to the root of things and to point you in the right direction for treatment. So for some people, these symptoms may last a long time, but if you're not getting the right treatment, not seeking the right medical attention, the symptoms might last longer than they need to.
Okay. Thank you. And I just wanted to thank and address some of the questions that we received. There were a few that were had some things in common in terms of people having that loss of sense of smell or taste. One person mentioned smelling a persistent smell of cigarettes, even though she's not a smoker, and she's tried smelling essential oils, things like stronger smells to as you mentioned earlier, retrain her smelling capacity. What would you say should be the first step for people in this situation?
Yeah, thank you for posting this question. And the person who posted this made some great suggestions of a variety of different smells that she is using to recover. That I guess was recommended by her ear, nose, and throat physician. So those are great suggestions to get things started. And this definitely has been one of the more perplexing and challenging symptoms to manage. And we are seeing people who are having these symptoms for quite a prolonged period of time. As I said before, an evaluation from an ear, nose, and throat physician is a must, because you do need somebody to look at your nasal passages, make sure there isn't anything else going on that could be causing these symptoms. And the interesting thing, as most of you probably know, is that smell and taste are very closely interconnected. That's why when you have a cold, food doesn't taste so good when your nose is clogged up. So that's also part of the evaluation. We've had patients say, "Oh, I lost my taste," but we come to find out most of it is actually related to the nose for some people.
Okay.
Uh, and aside from ruling out other conditions, the smell training, as we talked about, is something that has been looked at in some studies, that is worth trying, potentially on your own, or as I said, many of our patients will work with our speech therapist or speech language pathologist to supervise this type of treatment. Uh, and there is actually something called taste training as well. It's not as well studied as the smell training, but it's essentially the same concept. It's tasting lots of different tastes, sometimes some strong flavors. There's actually some reports of people biting into an onion as if it's an apple, which of course sounds really disgusting.
Right.
But people do things like that. So, I can't necessarily endorse that from a high level of, research evidence, but these are some of the types of things that people are trying. So again, I think the important thing is, don't necessarily go it alone. Have a medical team, behind you to help point you in the right direction for these symptoms.
Great. Thank you. We have a question from Sharon. She mentioned her experience has involved having bilateral pneumonia. She has a persistent cough. She mentioned that loss of smell and taste, and also brain fog. So she's curious if there are any studies on these symptoms, and what can be done to fix that. I guess to the point of brain fog. Who should she see?
Right. So I guess starting with the brain fog, she had asked, if there's studies. Yes, there have been studies coming out looking at some of the different components of this brain fog, where people are struggling the most. There's still no magical treatment for this, other than really the cognitive rehabilitation that we talked about, that our speech therapists will do, but also making sure you're uncovering underlying issues that are affecting the cognition. I send many of my patients for these very, very thorough evaluations of their thinking that are done by our neuropsychologists. And I will tell you, oftentimes the evaluations end up being relatively normal,
Okay.
in terms of, people are actually doing quite well cognitively. But it may be something else that's affecting their thinking, whether it's that they're very anxious and that needs to be uh, addressed. Maybe they're just really not getting sleep and we have to, maximize their sleep. So, what I would recommend is, definitely don't go, do not go this alone. That's one of my take home messages for today is, don't just sit there at home. Know that there's people out there that want to help you and, seek that care because there are answers for you. Um, and, in relation to the first part of the question about the lungs, the answer is yes. There are studies that are showing some patients some permanent, well, I don't want to say permanent, but significant lung damage that is seen on imaging even, months after COVID illness. So, the question as to whether this will go away, we don't know yet. We certainly hope so. In those cases, we always will recommend, our patient sees a pulmonologist or lung specialist for evaluation. And, while the lungs are recovering, hopefully, there oftentimes are some symptomatic treatments that can help you feel better as your lungs are recovering.
Great, thank you. And thanks for your question. We have another one from Claudia who says, will post-COVID headaches and dizziness ever resolve? And I know you mentioned this, we're still learning about this virus and sometimes symptoms can be prolonged, but for patients in a similar situation, what can be done if you constantly have headaches and dizziness?
Right, Shane. I mean, you hit the nail on the head. We don't know yet quite how long these symptoms will last for some, but the key is getting the right evaluation and treatment. And for persistent headaches, we're often having our patients see our neurologists for evaluation, just to make sure there's nothing else going on with the head or brain that could be causing persistent headaches. Many patients can be adequately managed with different medications, whether it be over-the-counter medications someone might use for headache or potentially some prescription medications. Some doctors have actually looked at using some different supplements for persistent headache symptoms after COVID, almost equating this post-COVID headache to what we sometimes see in concussion, actually. So we don't know this. It has not been, well studied in the COVID population, but some people have been using some of the similar supplements we use in concussion care, such as omega-3s, magnesium, vitamin B2. Again, I generally do recommend, you talk with your healthcare provider before just starting these blindly, but, potentially there could be some benefit. But the dizziness, I will say, is one of the things I've seen improve drastically in a number of our patients, either through, the natural course of improvement, people's bodies healing, but also through the vestibular rehabilitation I mentioned previously that many of our physical therapists are trained in can really, really help resolve some of the dizziness symptoms.
All right, thank you. We received a lot of people are having similar issues, and that calls to attention what you spoke about earlier, that some people you're seeing persistent symptoms of whether it be headaches, nausea, dizziness. I just want to give credit to those people who have asked this question. So thank you to Gary and Vicky and Shirley as well. So make sure to share this with your friends. Let people know the options that are available to you. In particular, with Vicky's question, she says that she's on gabapentin because she was having some numbness. That stopped, and then she started feeling numbness on the left side of her face. The EKG and the scan of her lungs and chest were normal. Her big question is, will she ever get back to some sort of normalcy? And I think that's a larger question for many of us. What can be done for someone in Vicky's case?
Yeah, I mean, one of the things we are seeing, it doesn't make the top of the symptom list like fatigue and brain fog and some of the other things that were mentioned before, but we are seeing nerve symptoms in people recovering from COVID that are presenting in different ways. Some people may be familiar with the term neuropathy, which basically means some type of nerve injury, often thought to be associated with diabetes or other conditions. So we're seeing some symptoms that can be consistent with nerve injury in our COVID patients, potentially even affecting what we call the autonomic nervous system, not to use too much medical jargon today, but that's the part of our nervous system that affects parts of our body that we never think about. such as our gut, our heart rate, our breathing, our body's temperature regulation. So sometimes people are reporting some of these symptoms like a rapid heartbeat, an unusual temperature regulation, and that may be actually a nerve-related issue, and can cause some of the numbness symptoms that Vicky was describing. So again, neurologic symptoms like this can be complex and really do require a thorough evaluation from a qualified health professional. You could certainly see your primary care provider, but oftentimes a physiatrist like myself or a neurologist, would be very helpful to more thoroughly evaluate the nerve condition. Sometimes there's some advanced diagnostic testing that can be helpful. And then depending on what the underlying cause is, we can direct treatments accordingly. It sounds like you're taking a medication called gabapentin. That is a good and very commonly used medication for nerve-related symptoms, but there are others. So maybe it's not the perfect medication or dose for you. So that's something that needs to be addressed. And one thing that we have seen with other nerve conditions is that often physical activity does help. So even if you're not feeling so great, one of the things you're going to hear from us like a broken record is, we always do want you to slowly and gently increase your physical activity, listening to your body. And one thing to mention about physical activity, what we're seeing in our people recovering from COVID is that COVID recovery is not linear. What we mean by that is that it's not in a straight line. It's not that you're going to get slowly better and better and better every day like this. People have ups and downs. They have good days and bad days. And that's why it's important to listen to your body. If you're having a rougher day, you may, you could still exercise, but maybe at a gentler pace. If you're having a better day, maybe you could push yourself a little harder, and then you can see how you respond the next day. If you feel good, well, then wow, maybe that exercise was something really good for you. If you feel lousy, maybe you took it a little too hard and you may need to back off a little bit.
All right, thank you. We have a few more questions. We have one from Chrissy. She says, have you heard of patients with intermittent fevers lasting longer than 30 days? She was diagnosed with COVID in late January, and she's still experiencing fevers.
I have not seen that in the medical literature, but I have actually seen one of our patients here in our COVID recovery program with similar symptoms. I think for that, the challenge is that there are a lot of different things that can cause those kinds of symptoms. And just as a brief aside, I think one of the interesting challenges that we've seen as we've been treating COVID survivors is that even if you're a COVID survivor, you may have other illnesses that are not COVID related, that maybe you had them before COVID, maybe they started after. And it's something to keep in mind, that it is important to, not necessarily say everything you're feeling is related to COVID. And that's why, a good, thorough medical evaluation can help to kind of piece together, well, this appears to be, COVID related, this may not be. And then that's going to guide you to the most appropriate treatment to help you get better. So in this case, with the intermittent fevers, we would probably want you to see an infectious disease specialist, would be important. And we'd want to do a very, very thorough review of your medical history to be sure that there aren't other things that can cause that. But we don't know if that's a function of the nervous system, that we just kind of talked about. You would probably want to have some lab work done to rule out any hormonal disorders. So there's a lot that goes into this evaluation. So, as I've said before, do not go this alone. Make sure you are, seeking the appropriate medical care so that you can get better.
Great, thank you. We have a question from Alta, who says, they want to know, where can you go for an antibody test? And I'm not sure if that's part of the initial evaluation for the COVID recovery program, but Alta says that they had similar COVID-like symptoms at the beginning of March last year, so right at the beginning of the pandemic last year, but was never officially diagnosed. Can people still inquire about the COVID recovery program, or do you need to have had an official diagnosis to be in the program?
Great question. Yeah, so we don't actually standardly do the antibody testing as part of this program. If it's something that you feel is warranted, I would strongly urge you to talk to your primary care provider to maybe do that testing. But as it pertains to being seen in our COVID program, the criteria for being seen in our program is that you either need to have had a positive COVID test or symptoms that strongly suggest having had COVID. We certainly understand that, so many people, especially, very early on in this pandemic, did not have access to testing. And we're not going to deny those people, of our care just because the testing was not available. It is not absolutely required by any means to be seen by our program.
All right, thank you. We have a question from Brandy. They say, prior to my diagnosis of COVID-19, I was healthy. Now, 6 months later, I have heart palpitations, anxiety, thyroid issues, brain fog, fatigue, etc. How long until I get my old self back?
Yeah. Again, I mean, I think that description, perfectly sums up what I said before about taking a village. I mean, I think that, again, the heart rate issues could be related to the nerve issue I discussed before, or it could be a heart issue. So, many of our patients are seeing cardiologists for a more thorough evaluation to make sure your heart is functioning properly. We've talked quite extensively today about some of the treatment options with brain fog, the thyroid issue. uh, you know, it's hard for me to say in this setting whether or not that's a COVID related issue, for sure. But certainly there's a lot available medically to evaluate and treat a thyroid condition. So that's really a perfect example of just the wide array of symptoms that people are facing after COVID that we are doing our best to manage at this time, and we certainly are hoping we have even better answers for this in the near future.
Thank you. And thanks for your question. We have another one from Yolanda, who says, I'm still on oxygen at home and having problems breathing. How long does this last? And they've been battling this for about a month and a half. So I'm not sure if that's sustainable to be on oxygen for that long, but what do you have for Yolanda?
Yeah, I have not been seeing too many of our patients that have been on oxygen that long. But it is certainly conceivable, as people are, those who probably had a more severe acute illness. I wonder if this person who wrote into us, was quite sick, early on in the course of illness requiring hospitalization. It would not be terribly surprising. I think in an older patient, we might expect the need for oxygen for a longer period of time, or if maybe there were any pre-existing underlying lung issues, which, sometimes patients know about, sometimes they don't. I would not anticipate, unless there is some significant, underlying lung issue that, the person would need to be on oxygen, forever. The hope is that they, will recover like, many of our patients have. But for this person, we certainly hope you have the right medical team. If you're still on oxygen 6 weeks out, I would assume you are hopefully being closely monitored by a pulmonologist, primary care physician, getting the right evaluations and treatment so you can move in the right direction. But I would certainly hope you would be recovering very soon.
Great, thank you. We have a question when it comes to variants. So this question is from SJ. They say, is it more likely or less likely to be affected with long haul symptoms if you had a variant of COVID?
I am not aware that there is any data on that yet. It's going to be interesting. I would be willing to bet in the next few months there'll be more information coming out about that. But that is not any scientific data I've seen yet.
Okay, thank you. And then we have a question from Nikki about the ongoing symptoms. So she asks, is back pain a long-lasting side effect of COVID?
I would not say that I've seen back pain, but we definitely can see muscle pain of different areas.
Okay.
Sometimes it is more diffuse muscle pains, kind of all over the body or in different parts of the body. That is something that we definitely have seen and, can be a persistent symptom. I can't say I've seen someone specifically with just back pain. For me as my primary job being a physiatrist, back pain is kind of bread and butter of what I do in my work. So I think for someone like this, certainly needs a very thorough evaluation of the spine, a good physical examination, potentially some imaging of the spine, to make sure everything's looking okay there, and directing the appropriate treatment. But muscle pain, yes, that's something that we've seen a lot of.
Okay, thank you. And we have a question from Julie and a similar one as well from Claudia. So I'll couple your comments together. So one part is, should long haulers get the COVID-19 vaccine? Or do they need to wait to get it?
Right. So the initial guidance a little while back was to wait at least 90 days after COVID illness before getting vaccinated, but that has now been waived. So for the most part, unless there's some other reason we know of, we generally are encouraging people to get the vaccine because, we know that, even after you get COVID, you could get it again. And you don't know, maybe your illness was mild the first time, could be more severe the second time. And, we don't want that to happen to you. So, we would like you to be as protected as you can be from COVID. So for most people, we are recommending that. There are some very, very early reports that are, probably too early to strongly endorse, that some people are saying that the vaccine could be improving their long COVID symptoms. I certainly can't look anyone in the eye with certainty and say that that is a definite, but as more research comes out, if that ends up being true, that would be a really great new development here for people suffering with these symptoms. But as I said, in general, we are encouraging people to get the vaccine.
Thank you. That's a segue to another question from Brenda. She just received her first dose of the COVID vaccine almost after 90 days of being sick with COVID. So she's a COVID survivor. She's heard that getting the COVID vaccine can help you get that your sense of smell and taste back. So I guess time will tell with the research that comes out in the coming months, but have you heard of that as well?
Like I said, I think there's a few early reports with some promising information, but I would be hard pressed to, tell someone that most definitely their symptoms are going to, go away after getting the vaccination. It has been reported to some degree, and I certainly hope we find out more about that. So that gives people some hope.
Awesome. All right, we have a very specific question. So Brandy asks, if I have a HX of anaphylaxis, can I get the vaccine? I was told yes and no. So what is this guidance? I guess some sort of allergic reaction, perhaps.
Correct. Yes. Our person writing in is using some medical lingo, HX meaning history of. So I appreciate
Okay.
that. But so it is a tricky question. I mean, it is something that you're going to want to discuss with your doctor, because there certainly could be a risk of anaphylaxis, with this vaccine as well. For some who are very, very concerned about it, sometimes people are sort of at the ready with medication that could potentially treat anaphylaxis, right there in case it were to happen. I've definitely been hearing about people with a history of anaphylaxis getting the vaccine. So I wouldn't just do it. I would make sure to talk with your medical team about it. So if you do it, you're prepared for it.
Great, thank you. And Claudia asks a similar question. What about getting other vaccines if you've recently received the COVID vaccine? Do you have any guidance there in terms of waiting?
I'm not aware that there should be any concerns there.
Okay, awesome. All right, and then we have one last question from Jane. And we received a few other questions like this. They want to know, how can they get into the COVID recovery program?
Right. So we would definitely recommend that you go to our COVID recovery program website. Registering through that site is really the best option for you. Is that something we're going to be posting here in the
Yeah,
chat for
we're
people?
gonna we'll provide that link for you all um, in the comments below.
Okay, yeah. I mean, you can if you Google, MedStar COVID recovery program, you may find it, but we'll certainly post that information for you here. You could get a referral from a physician. You can also register yourself as well through our webpage.
Great. And thank you to everyone who has shared your questions and feedback in the comments as well. We really appreciate it. As we close, Dr. Wazatsky, is there any other information that you would like to share?
I just want to say, and hopefully many of the people who are writing in with questions here can see that many people are dealing with this. If you are suffering from these symptoms, you are not alone. This is a very common thing, and I would say that psychologically, many of our patients have told us that coming through our program and seeing our team has really made them feel so much better, just validated, knowing that they're not alone. Maybe they have gone to see other healthcare providers that, might have told them their symptoms were in their head and things like that, that were very discouraging. So a lot of our patients have just been thankful to be heard and to know that we're trying, to really do everything that we can to manage these symptoms. So please just know that you're not alone. I'm a big believer in hope. As I mentioned, my day job is taking care of cancer patients and cancer survivors. So I know from those patients that I take care of, I think those that have a strong sense of hope that they're going to improve and brighter days are ahead, makes a big difference for them. So, while there's still just so much we don't know about COVID recovery, I'm certainly hoping for, all of you, all the patients that I see that they're going to be turning the corner and these symptoms are going to be improving. So, I certainly want to instill that hope upon you that better days are ahead, for all of you. And, for me, it's certainly an honor to be a part of this medical team and to help people through with this, very, very, very challenging illness. So thank you for joining us today.
Thank you very much. Thank you, Dr. Wazatsky. And thank you to everyone for tuning in and sharing your questions with us. For more information about the post-COVID recovery program at MedStar Health, please visit medstarhealth.org/COVID recovery. We're going to provide that link as well for you in the comments below for more information. So that's a wrap. Thank you very much again for joining us, and we will see you next time. Bye.
Thank you.